Welcome to today's meeting of the Health and Wellbeing Committee. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you've left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Do we have any substitutes this evening?
No substitutes.
Any declarations of interest? No. Any public participation?
No.
No. Let's look at the minutes then. Right. Is everybody in agreement that the minutes are a true and accurate reflection of the last meeting? Yep. No issues, Richard? No. You look like you're ready to say something there. Okay. In that case, we'll move on to the first report, which is the joint working opportunities with Worcester City Primary Care Network.
Sorry, Chair.
Yes.
I agree that they were a true and accurate record, but there was an action which was required on the minutes, which I'm just seeking information about whether it's actually happened, which is the top of page 2 of the minutes, where it is requested that chairs and vice chairs establish a way forward on the issue of physical activity. Can you confirm if any such meeting has taken place, and have we won?
A meeting has taken place. However, we are at a bit of a stalemate on that one. So we're at a bit of a stalemate. There's an ongoing discussion happening, but I think for the moment, physical activity will be staying with the Communities Committee.
Well, can I just follow this up slightly with you, Chair, because I do have a concern that one of the roles and responsibilities for the Health and Wellbeing Committee as agreed in annual council was to have responsibility for mental and physical health and well-being. Can I ask how we can do that if we're not going to have any say about physical activity as directed by the Communities Committee, and whether we are not fulfilling our duties as a committee by not taking part?
I don't disagree with you, but the advice that we have been given by Sian Stroud is that any ongoing agenda items that belong to another committee cannot just be given to this committee. And in order to do that, there would need to be a motion to full council.
On that basis of this committee, a report on physical activity and what kind of opportunities we would have as a committee to look at it, monitor it and study it to make sure that we have got a say in one of our areas of responsibility, which is physical health and well-being. I'm not trying to take areas from another committee. I want to know what kind of responsibility we do have, what we can do and what we can be party to. A report for information for this committee to know what its responsibilities are would be incredibly useful, especially as we have got a responsibility in this area which we're not yet fulfilling.
Thank you, Chair. Yeah, just to reiterate the constitutional advice, that wouldn't sit within this committee at the moment, Councillor Udall. Just to reiterate constitutional advice, that wouldn't sit within this committee at the moment. So my advice is we wouldn't be able to bring that back unless there was a motion to council that sort of shifted responsibility for that area of the council's work.
I'm not asking for that. What I'm asking for is reports to come to this committee on our roles and responsibilities within the Office of Health and Wellbeing Committee in the area of one of our areas of responsibility, which was agreed at annual council, which is mental and physical health and well-being. We need to know what we can do and what we can't do, and I'm asking for a report to come back to this committee on that, so we know what area of responsibility we do have in those areas and how we can influence them. I'm not asking for anything to be taken from another committee or to be snatched or changed or whatever. I just want to know what we can do as a Health and Wellbeing Committee in an area of one of our areas of responsibility.
I'm not going to commit to a report, Councillor Udall, but I'm more than happy to take that away and discuss it with the Chair and Vice Chair further.
I don't want to pursue this unnecessarily, but if the committee makes this request for a report, surely that's something the committee should have.
I think it's important to note that between now and our next meeting, there is a meeting of the full council. So I think if you've got any concerns about it, it would be worth bringing them to full council.
I don't think you're picking up and understanding what I'm actually saying.
We are, but unfortunately, constitutionally at this point in time, all physical activity has to stay with the communities committee, is my understanding.
I'm not asking for that.
Chair, I think, through you, Chair, I think what Councillor Ewell is asking for is what is the remit of this committee under the guise of what was given in under the motion at full council. If it says health and well-being, how are we supposed to look after the health and well-being under this committee? So that all we're asking for is what is under this remit and what falls under that in those. So we're not asking for anything new. We're not asking for a motion.
Yeah, and absolutely, Chair. And what I'm prepared to do
the working framework of this committee.
And what I'm prepared to do, Chair, is to go away and work with yourself and Councillor Dem as Vice Chair as to what that may look like. What I'm not going to do, Councillor, is commit to a report when I don't know what that looks like, if that makes sense at the moment. But I'm more than happy to go away, talk to Chair and Vice Chair about what that, what that report may contain.
I remain a little confused because I'm not sure what the purpose of this committee is, and it's clear that Chair, yourself and our officers aren't really sure what the role of this committee is. And if this committee can't even ask for a report to come back to it to explain our duties and functions, I'm not really sure what we're doing here.
Yeah, so the motion at full council that was approved set out 5 or 6 bullet points that covered this committee's responsibilities. It's quite a broad area. I wouldn't disagree that it needs some definition. And that's why I'm more than willing to go away from this meeting, work with the Chair and Vice Chair on what that may mean. So that is my offer.
Does that satisfy you now? I can tell. Yeah, I think it's important to note that there is an ongoing discussion taking place, and we can't bring a report back to the full committee for something that falls out of our remit at this current time. Mike?
Just so I'm clear, there's nothing in the Constitution, is there, or if there is, tell me, that stops one committee reporting to another? And that's basically what we're asking for. If it sits in Committee A, but Committee B has an interest in it, they need to tell us what they're doing, and we then need to reflect on the impact of that. That's all we're asking for, I think.
It's actually, it's more than one committee. So the Corporate Parenting Board is actually discussed as PED as well because of the skills agenda. So I can't see.
No, I don't disagree with any of you. I really don't. I completely sympathise. It's very muddy because it is very difficult to determine what our remit is and what the remit of other committees are. And I think this is only our second meeting, and I'm not entirely sure that the complete purpose and role of this committee has been properly defined yet.
At that point, Chair, you have our full support to gain in the full authority which this committee needs to undertake its functions.
Thanks, Richard. With that being said, can we move on to agenda item 5 now?
Thank you, Chair. Chair, this is a follow-up report to a previous item at the last committee that we received from Sue Harris at the NHS and the work that was being undertaken around the move to integrated care system. And members will be aware that as part of that work, conversations have been ongoing around the transition from STPs to integrated care strategies. And as part of that piece of work, we've started to develop really good relationships with the Worcester City Primary Care Network. So this report is intended to bring members up to speed on those conversations, some of the work that we're currently undertaking, some of the future opportunities. Just by way of a little bit of background, NHS Herefordshire and Worcestershire Clinical Commissioning Group That's made up of 83 GP practices across the 2 counties. And within that, practices have joined together into 10 what we call primary care networks, which consist of groups of GP practices working together with a range of local providers. Networks are generally based around sort of 30 to 50,000 population. Worcester City is slightly unique, slightly larger than that. But I think the reason for that is because we're a very sort of distinct city-urban area of ourselves. So that's what warranted that. 10 GP surgeries, and the clinical director is Dr. Nicole Berger, and we've listed at 2.4 the surgeries that make up the Worcester City PCN. Appendix 1 of the report includes some visuals around the wider Worcestershire primary care networks and the Worcester City network in itself. As part of the conversations, we've sort of shared priorities with each other. So for instance, we've shared our Worcester City plan, the current version, the COVID-19 Community Recovery Plan, and conversely, colleagues from the PCN have talked through their annual priorities, many of which get passed from government for them to work on. And it's through that that really it's reinforced that there are probably things that we were, working together on the periphery anyway. Some projects that we can start to look at more clearly, and some sort of future work as well. And that's what the report intends to set out. The first piece of work that's been ongoing for 18 months is around our rough sleeper work and everyone in. And obviously one of the first cohorts to receive their vaccination was rough sleepers because of their vulnerability and their sort of existing pre-existing health issues. And that was successfully delivered, a collaborative effort between the council acting as an enabler, colleagues from partner agencies such as St Paul's providing the physical building to do it from, but amazing work from PCN colleagues to provide the resource to be able to vaccinate a difficult group in terms of sort of getting them into one location and that. Further on from that, when we housed rough sleepers, you can imagine, a variety of health needs, some of whom, might not have accessed healthcare for some time. And as part of that moving into the Founds Hotel, we were able to provide everybody with the offer of medical access, whether that be GP and health staff coming into the Founds or rough sleepers going into a medical facility. And that's the first time for many people they would have had health support for some time. So again, a really vital part of that Everyone In programme to ensure that everybody was safe and well. And then moving forward, I think we've identified that we as a council and certainly support agencies can play a role in supporting PCN colleagues and GP surgeries, particularly around managing prescribed medication. It was really interesting to sort of see the flow of prescribed medication when we had rough sleepers all in one place, and there's sort of a lot of trust that goes into that once you sort of hand that prescribed medication over. And I think one of the things that GPs have struggle with is to keep access and to keep contact with rough sleepers. Well, we are perfectly placed to do that, whether it be through outreach support workers, our housing service. So there's definitely a role that we can play there to support PCN colleagues. Another area that we are keen to move forward is around the social prescribers. So our primary care network colleagues have commissioned an organisation called Onsite to provide social prescribing support and lifestyle advisors. And a lot of the work we do, whether it be housing, environmental health, community services, a lot of the families and people we are dealing with, there's a real support need and sort of multi-complex issues at the heart of those. So a role such as a social prescriber can sort of knit all those things together and be a real good signposting option for us. So Nina and the team are actively pursuing conversations with PCN colleagues to see if we can get social prescribers sat alongside housing officers in Trinity Street. So rather than having to palm off, that's the wrong term, rather than having to signpost into another organisation or into another building, it's that sort of one system approach in dealing with everybody under one roof. 3.6, we just touched upon a scheme that many members will know as exercise by prescription. I think we used to have something in Worcester or perhaps across the county in recent years, but this very much recognises that we know across the city We have communities who are, this a significant a difference in health status of some of our communities, with some communities not able to access leisure facilities as freely or as comfortably as others. And that's a sort of a national issue, particularly in urban areas. The lifestyle advisors in GP surgeries are really well placed to signpost into an exercise by prescription scheme. So again, colleagues from Freedom, Alan New from the council, PCN colleagues, we are going to look to try and revitalise that and recommence something. And the important point to note here is that not everybody is comfortable walking into a gym, and therefore utilising community assets, community centres. This will be a big part of that. It's not just about going into a gym or going into a swimming pool. Some people are not ready for that, so we'll be very conscious of that. Diabetes, one of the national priorities for primary care network, and again, members will be very familiar with the sort of that sort of policy area. I know, but building very much on our sort of pop-up vaccination centres that we've run. The PCN like the idea of running something micro-local, so they've seen the sort of uptake in people coming to a site like Brickfields for COVID vaccination, and how word of mouth and convenience has played a real part there. So we are keen to, again, not just Brickfields, it may be different venues, but again, to provide diabetes clinics and similar clinics to those communities where we know they aren't accessing medical facilities as readily as perhaps some of our other communities. Members will be again familiar with our disabled facility grants work, very sort of mainstream, very traditional piece of work undertaken by district councils, and in conversations, it just cropped up that the PCN were also going to employ their own occupational therapist. And that was because, preventing falls, supporting people to remain in their own homes, again, is a key priority for them. So members, may recall, particularly those who sat on Communities Committee, that one of the things that we were looking to do to improve our disabled facilities grant offer was to expand that out. So at the moment, you have to meet a certain criteria to receive a disabled facilities grant. What we wanted to add into that was a paid for element. So even though you may not meet the criteria, to have a grant for disabled actions, you may be in a position to be able to pay for that yourselves. And with the occupational therapist sat in the PCN, I think there's a real link there. We've got a framework that already delivers those sorts of works, that has contractors, and there's a real opportunity to join up and make that happen. So there's just a flavour of some of the things that are going on, Chair, and we'll continue to progress over the next few months. And I think the council's role in this isn't singular. I think it's a range of roles, so it's not just some of the assets that we own and can be utilised better. It's the services that we deliver that also link closely with health and wellbeing. It's the reach we have, across all our services. We're touching thousands of people every week, every month. I think it's also the influence we have within communities, and I don't mean that just from an officer point of view. I mean that from a member point of view as well, not just within your own wards, but with your own portfolios and lead areas. So hopefully that gives you a feel, Chair, and that's something that's built on the previous report of committee. Happy to take any questions.
Thanks, Lloyd. I think before we go to any questions, I think it probably is worth pointing out that this report in some way highlights the point that Richard and Mike and Lucy have made when we were discussing the minutes, because there's a number of issues that have been raised in this report that I think I would quite like to know more about, but they do technically fall under the remit of the Communities Committee at the moment, in particular the Everyone In programme and the public health and wellbeing of our rough sleeping communities, but also things like exercise by prescription. How are we able to have oversight of this if at the moment our leisure facilities come under the remit of the Communities Committee?
Yeah, very much noted, Chair, and that's why perhaps I didn't come across particularly clear, but that's why sorry to repeat myself. I'm more than happy to take that away, Chair, discuss it with you and Councillor Denham around what that may look like in terms of a report.
Thank you. Does anybody have any questions, Lucy?
I'm very I suppose really I'm actually, having had a stroke recently, I believe that anybody within this city should be aware of this and able to actually access it as well. And I hope it isn't just the more vulnerable people, but it is everybody who in some way and perhaps in a way sometimes those people that think, oh, it doesn't matter to me, actually it really does matter to me. So it really does matter that everybody in the city can access something, whether it's and only perhaps in a while they actually can be on their way and that sort of thing. But I really do think it's accessible.
Hello. A friend of mine is a NHS dietitian, and she works with stroke rehabilitation for Stourbridge, I think it's Stourbridge, I think it is. They have a team up there which is associated with the hospital, but they go out and it is occupational therapists, speech therapists, dietitians. It's everything, those people, and they work in teams to go, and they go around and they see all the people that they're bringing. So they get them out of the hospital, they start working with them. As soon as they've had the stroke, they are at this bedside working with people to get them back out, get them back home and alleviate their problems and avoid their issues. And the one thing she does say is, every time it gets to me that why didn't I as a dietitian get to these people before they had the stroke? If we could get to the people before they had the stroke and perhaps stop the stroke happening, because some can be prevented, not every stroke can be prevented, but if it can make people live healthier. She's now moved on, the team is now dealing with Parkinson's and motor neuron and all sorts to help these people stay out in their homes with their families, and they're happier there. People are happier with their families in their own home.
Can I just add? I was on so in South Worcestershire there was a similar team, and I certainly was under them for I think 8-9 weeks. Absolutely brilliant, and they were confident that I was able to feel my way, and they weren't there. But sometimes that's what I meant, so that yes, there were referrals, but sometimes then they're quite a long way away. So I actually haven't had any referrals since that. And so that's what I mean about anybody can have a stroke or whatever, and we just make sure that people get the help.
I wonder if, Lloyd, we could potentially look at having some sort of an awareness event within the city for something like this, because I mean the points that Karen and Lucy have both made are very valid, but there's also a lot of other indicators for stroke besides diet and exercise that I think it might be worth people knowing about.
And Stephen also has the stroke.
Stephen's mayoral charity, and you want to plug your 10,000 steps as well at the same time?
At the moment, I'm walking 10,000 steps a day. I've now done it for 6 weeks. I'm halfway through, and for the Stroke Association. So any sponsorship, most welcome. But it's those sorts of things that are really good.
Councillor Hodgson's exercise regime put me to shame, Chair, so I feel we could do that. Yeah, I think yeah, it sounds to me that's a sort of community health type service. I know in Worcester and across Worcestershire, there are neighbourhood teams that sort of deliver that. So more than happy to go away and talk to the neighbourhood team lead chair to see if we can bring some back to members.
Brilliant. Richard?
I will freely admit to being morbidly obese. I have a distinct problem which does need to be tackled. And when I asked my GP for help and assistance, the response was, it's quite simple, eat less, exercise more, which was not the answer which I was seeking. I was seeking help and assistance in order to try and lose. I know why I'm overweight. I know there are background issues, which I won't go into it, but there are specific, I am not alone. There's a lot of people in the same situation as me. And what I find fascinating, and I've discussed this many times before, is the idea of social prescribing and issues such as what we've got here about prescribing exercise. There has been, this activity has happened in the past. It's putting it bluntly, usually in upwardly mobile middle class social demographic areas. It doesn't necessarily target the areas and the people who need it the most. I would be interested in seeing what we can do over and above what is being done by the primary care network to actually finance, support and assist social prescribing. So we can establish walking groups in our communities which are the most hardest to reach, and actually encourage our GPs to actually prescribe people to join those walking groups. It's the first step, which is often the most difficult, and get people to go to there, to people who are in the same position as themselves, who are not physically fit, healthy and well-being, and obviously without the need to gain exercise, to join people who are in a similar situation as them would give a morale boost, an assistance and a push in the right direction. I'm not sure how we can do that, because that may be treading on the toes of another committee. But I think it's absolutely vital and critical that we do that, find a way to finance, support and legislate for a form of social prescribing in some very basic requirements, such as social walking in some of the hardest hit communities, and get people out and doing it. I would willingly lead and follow it, but I need to have the help and advice to get there. And so do a lot of other people.
Yeah, I think it's a really valid point, Chair. That sort of, it's a journey, isn't it, for some people? Something like I say, when I was presenting my report, some people, not comfortable walking into a gym or a swimming pool. So really valid points, Councillor Newland, and I'm more than happy to take that up, Chair, with the PCN directly. And I was just having a conversation with the CEO of WCT this afternoon, and even though we speak regularly, I didn't realise the range of, I won't call them exercise classes because it isn't exercise, but it's activity. This activity in its broadest form. So probably as well, Councillor Udo, I challenge myself and my officer, are we tapped into that enough? Are we communicating that enough widely across communities? Those existing activities. So yeah, more than happy to take that away, Chair.
In that case, could I add another request then? Could we possibly have perhaps Warwick at a future meeting, in as well as doing activities to tell us what if any we're going to have coming out of his team, and perhaps if we could have somebody from onside and social prescribing coming along to discuss it with us, because I know myself and several other members who have been previous members of the communities committee will remember when we had a lady come and discuss social prescribing with us a couple of years ago. But there's a number of new faces, and not all of us have sat on communities committee, so it might be worth having a bit of information on social prescribing. Yep. Robin?
Thanks, Chair, but I'm afraid Councillor Udall stole my thunder, as well as my concerns about treading on the feet of another committee. So thank you all for the same, for the opportunity.
Jabba?
Thank you, Chair. Can I say, obviously, Councillor Hodgson's story is an inspirational one, and she's really blessed to have obviously recovered from that, and she's making the most best use if she can of her extended period of life. So and she's really fortunate. Obviously, there are a lot of people that aren't that fortunate, and being from a community that is at increased risk of heart attack or of stroke, it is really clear to me that this is something that we can take out to that community as well. Now, I'll just give you an example in terms of obviously health inequalities within certain parts of that community. Obviously, diabetes type 1 and type 2 is the most prevalent, and that's really stipulated in reality. The lack of services, or lack of not care, but lack of what I would say is that where that particular community is so below par that even we still haven't managed yet to date get a defibrillator, which is present in most public buildings, in most community centres across there, and we still haven't got a defibrillator in the heart of the community. And we've had people that have died of strokes, of heart attacks, that could have been used of those things. Now, I've had to fight hard to get a defibrillator donated, but we're in the process of obviously getting that set up. But this is how long it's taken. So you can, it's not a case of us leveling up. It's getting to a level that we're on par with everybody else, and those services are open to us and accessible to us, so that we can get that life-saving or life-prescribing treatment to that community as well.
Thank you. Lynn?
Did you want to follow on from that? Thank you. Yeah, mine is a question around 3.9, and the disabled facility grants now are really successful and absolutely enable people to remain independent at home. Are the dementia support grants still continuing? Because that was a innovative scheme that we had in Worcestershire, and really for very small amounts of money, a piece of kit that reminded people what time it was, or enabled to be monitored if they sort of left home or got lost, has been really beneficial again in enabling people to live independently with dementia. And I'm not clear if that's still continuing into this financial year.
I don't have the answer to that, but I'll certainly find out and report back to committee in writing if that's and take up any correspondence if for whatever reason it's not being continued.
I've got Steve, Stephen, Karen, and then Mike.
Thank you, Chairman. Yeah, I think it's a very interesting report. This with a lot of different facets to this, and one piece of information I heard a few years ago, which absolutely shocked me, because I represent Warner Parish North, which is a relatively prosperous part of the city. The adjacent ward in Warndon, we found out the life expectancy is 15 years shorter over there, which is absolutely shocking, considering we're in the same city and we have a health service now. And a lot of this could actually be prevented, but it's actually due to people exercising, poor lifestyle choices and that, and really people having illnesses that aren't diagnosed, and then they then become a problem. I think most people, when they get a serious illness, it's because of something that hadn't previously been diagnosed. I was fortunate enough that I discovered I had type 2 diabetes about 15 years ago, so I was able to act on it, get it acted on. So hopefully, touch wood, it won't cause problems in that. And because of that, I've been able to reduce the weight in that. But a lot of people, don't get that diagnosis in that. So I think it's very important that we get, particularly things with diabetes and that, we get these things identified, and that our health professionals, when they see people who could potentially have it, do get the diagnosis and do get the actual treatment, because we have got, regretfully, a lot of health issues stacked up in our community and that, and we do need to start tackling them, and also need as well our leisure facilities, making those accessible and affordable so people can actually use them as well. But there has to be the motivation as well, and that has to be self-motivation as well. It'd be nice to think that the Olympics are at the moment, we're inspiring people to go and get exercise. but it probably probably more inspired them to switch the telly on, get a pizza and watch some more live sport on the telly.
Thanks. Steve?
Yeah, thank you, Chair. Just a couple of things. First, really going off on what Councillor Udall was saying in relation to the experience he had with his GP. It wasn't that long ago that I was talking with some trustees from on site who were talking about the take-up of social prescribing and being acutely aware that some GPs weren't exactly sure what social prescribing was or was all about. So the idea of getting somebody from on site to explain to us how they're progressing that would probably be very advantageous for a lot of people. And then going on just to paragraph 3.9 again about people, elderly people being able to have the best opportunity to use their own homes, go back home after hospital, after falls and such like. I don't want to see perfect being the enemy of good, but I just wonder, we were talking about the number of patients within Worcester City's primary care network, 126,000. Well, I appreciate not all of them are elderly, but there will be a significant number of elderly people in that number. And the paragraph talks about comments regarding making the best use of an occupation therapist role, intending. I'm just wondering, you know, an occupation therapist, one, is that one for the whole of the city, or is that something that we should be aspiring to push and suggest it might be a good idea if there were more, so there is not queuing, there is not people sort of lining up and waiting for adaptations to be made to their houses so that they can go home or be home.
Yeah, again, I can follow up on that, Chair. I think the role is sort of still to be defined, sort of being recruited to as we speak. But I think what I would respond to Councillor is to say that, you know, if it is few in number, there is already an existing framework. There's a process, there's an application process, there's a contractor process. There's a, you know, a lot of the nuts and bolts are already in place. So I absolutely appreciate the point, but I think this is new territory for our PCN. So I think it's work in progress.
Karen?
Thank you. I'd just like to say in defence of my fellow councillor who raised his issue and how little sympathy he got from his GP. My own son got very little sympathy from a GP when we went in as well on the very same subject. And I sat a course called Obesity Causes and Consequences, and it is a lot more complicated than people think it is. It is not a case of just eating less and exercising more. There is a very complicated medical condition going on within some people, and they are trying to find out what it is. So this was 2 pharmacists and a doctor working on it. It's not straightforward, and we shouldn't condemn anyone who's ended up in this situation as bringing it upon themselves. They may not help themselves entirely, but it is certainly not something that these people choose to be in a state, and it's very, very difficult to stop yourself sliding into obesity. I myself have had to fight back from being a size 20 back in 6 months to being a size 10, but I hadn't gone over that point. And if you get beyond a certain point, your body will start fighting and it will stop you from losing weight. Like any form of entity, like if you've got a cancer cell growing within you that attempts to replicate itself and save itself from being treated, your own body will turn against you. And this is what they were finding with obesity, that there's triggers within your body and it will stop you from dealing with the condition, whether it's a mental condition or all sorts of things. It was quite complicated. The other thing I would like to raise is sort of loneliness. That's more of a mental health thing, but this is a big thing that people go, yes, we can send people back out to live, but we must be aware if they're going to be on their own. And that sort of thing is also a big, so it's that people feeling that they could actually reach out. And is there much of a network? I did get people say to me how lonely they were, widows who'd been made widow during or just before the lockdown, and elderly people who'd lost all their clubs and societies. So, just that simple meeting people.
I'd be very surprised, Chair, if there aren't groups or organisations that would perhaps not solely look to tackle isolation, but have a role to play. But again, I've not got that level of detail. But you know, I'm sure members can step in and
I can help you there. Yeah, on-side advocacy also have a county contract for, I don't think it's quite called loneliness service, but effectively it was, and the branding is plus, and I forget exactly what it stands for, but loneliness is in there somewhere. Yeah, yeah. So they're, you know, they're active on social media, you know, and open to, you know, phone advice and connecting people up with sort of clubs and social opportunities.
Thank you for that. Yes, I've got Mike, Lucy, and then Ditton.
Thank you for that. I really welcome this report. And the one thing, and I'm sure Councillor Denham would share this, the health service is very good at reorganising itself. But having had the pleasure of working in it and working with GPs, they are one of the consistent elements of the story. Right, some of their organisational boundaries change, but they are always there. So I'm sure the PCN is the right place to be talking to, particularly as we have a PCN within the city. A couple of things. One, and I can't remember, I think it was called telecare. Whatever happened to that? One of your fellow councillors used to report, Roger Berry used to report back on it.
I think I've on it.
And is that still going?
It is, because, but it's Wild Forest Housing.
Because I don't hear much about it.
It's branded as Amica 24 now. Amica 24.
Yep.
So it's set up as a charity. They have an amazing demonstrator room in a care home that shows all the kit and things. You know, when we were talking earlier about the dementia grant, you know, they have some of the facilities and so on. So it was actually Worcester Dementia Action Alliance this morning, and the you know, he calls himself chief exec, possibly, came to the meeting this morning, and I'm encouraging him to do some sort of more publicity, and you know, maybe like do an article in Worcester News or something. So yeah, very much in existence, and the technology, you know, is expanding.
Be really quite useful for him to come and understand and describe where he thinks we fit. Well,
yeah, Dr. Nick Wahlberger is the clinical director, and Claire Gould is the chief executive officer for the South Worcestershire area. And I think, you know, we're in holiday season. They've sent their apologies. They weren't able to get along this evening, but they are more than happy at some stage in the future to come and talk to members. So
I think it would be quite good to get into some specifics about how this committee can actually move this thing forward rather than the generalities. Yeah, so my last question was going to be, so what do you want this committee to do? And I guess that's a question for the PCN.
Lucy?
My mother actually wears a pendant. That it's and she sees a user of telecare. And actually, 5 years ago, my mother had a fall. She spent some time in hospital, and then in a community hospital. And when she was home, the occupational health were then she assessed, they then assessed her home, and in fact, only a couple of adaptations were required, but it was a good service, and preventions of falls and that sort of thing. And even now, she attends the doctor once a year to just assess that. And once a week, she's got a tablet, sitting up tablet, because and again, it just helps her stability. So I think some of this already exists, but I think it's really, really good that it's now now the PCN is now Worcester and other parts of the county.
I think I'm going to take Ditta and then Karen, and I think that'll wrap it up.
Thank you, Chair. I think Mike's asked the question that I wanted to ask anyway, but I have got another one that I'd just be interested to have some information on. 2.3 on the agenda, it says something that the membership of CCG of 83. Is that all of them, Lloyd, or is it just some of them are not joined up? And if not, why not? That's my role question.
Thanks, Councillor Ditter. And again, I think if somebody from the PCN was here, they'd probably be able to answer more accurately than me. I'm presuming that is in total across the Herefordshire and Worcestershire region. But again, I can double check that and come back if that'll be helpful.
Health Overview had a presentation of this, and yes, it does cover the whole of Hereford and Worcester, and so that N number of PCN.
All right, Karen?
Yeah, it's just the, we talk quite a lot about technology, and everybody's assuming technology, but I had a resident contact me, and he was living in the top floor of a residential, Noel Court, and their elevator was out. And he's 83, he's living on his own in the top floor. He could not report the incident to them. He could not get an update on the elevator, and he was ringing me and I was ringing them, because he has no ability to use any form of IT, and all he had was a phone. So he had no ability. He could sit, as I did, for 45 minutes on a call waiting to find out what was happening with the elevator, and it took 12 days and several phone calls to them to get it fixed. But yeah, it's this assumption everybody has these days, and we all do it. We've all got our tablets, we've all got our social media, we've all got our emails. Not everybody is able to deal with that, and we really mustn't let them drop. And they've got to be found as well and helped.
I think that's a really important point to make. I think we have to remember that a lot of the people who would benefit from some of these services are not going to be looking online. They're not going to be getting updates from the Worcester City Council website. They're not going to see the updates on our Facebook page or on our Twitter. They need to be physically contacted by us. They need to have a physical piece of letter. So yeah, it's one of those things. I think there's been a lot of discussion tonight about you know, lifestyle choices, or the potential lifestyle choices that may lead to some health concerns. I think it's really important to note, particularly from what Councillor Riaz was saying, some communities are at a much greater risk of things like diabetes, heart attack, stroke, those kind of things. And it's not through poor lifestyle choices, it's through genetic factors, but it's also through inherent inequalities in those communities. And it's addressing those things that makes a difference, not labeling them as having poor lifestyle choices or being lazy. So I think, you know, I'm glad that we haven't gone down that road so much when discussing this report. Can we agree that it's noted then? Yep. And then we'll move on to the report on the COVID-19 pop-up vaccination sites. Our update on that.
Thank you, Chair. Another note in the report, Chair, and just to bring you up to speed on the work around pop-up vaccination centres, like you say. Back in October, Chair, each of the districts across Worcestershire set up what we call an incident management team, and that's supported by the public health team at County Council, and I'm the chair of the Worcester City IMT. The focus flexes depending on what the sort of need and challenges are of the day, so to speak. And 2.3 lists out the representatives that sit on the IMT, and you can see it's sort of wide and varied. Back in October, cast your minds back if we all can, the sort of focus of the IMT was very much on prevention of COVID transmission, precautions to be set up by governments through guidance and legislation. And we developed a communication campaign around that, Don't Break Now. But we also had a key role to play in sort of meeting some of the monitoring and meeting some of the challenges faced by communities through the lockdowns during that period. The vaccination programme commenced in December 2020, and again at 2.5 we just listed out what the phase 1 rollout of that looked like, and in particular some of the priority groups. And in response to the vaccination programme phase 1, both the city and the county responded well. And as of the 18th of July 21, Chair, 82% of our residents aged 18 or over have received at least one vaccination, compared to 85% across Worcestershire. And in respect of second vaccination, 61% of residents have received a second vaccination compared to 70%. So not as good as the county average, but I think members will recognise some of the difficulties that come with an urban area, some of the challenges around that. It was sort of spring, once we'd gone through that phase 1 programme, when the focus certainly shifted to vaccination uptake, and the variance in rates that we started to see around vaccination, particularly on geography where somebody lived, and certainly ethnicity. And prior to during early spring 2021, a vaccine inequalities programme was set up across both Herefordshire and Worcestershire to look at that, including partners from right across the health sector. I've included in Appendix 1, Chair, the sort of some data from the COVID-19 dashboard that's publicly available on the Worcestershire County Council website. That illustrates what we call medium super output level. So it's not ward level, it's not micro level, it's in between. And on average, that's sort of circles around 70,000 residents. So it's useful. Members will certainly recognise some of the names there and relate that to wards. Just in terms of second doses, Chair, where we are at the moment, Northwick has the highest uptake rate. 74% of residents have had a second dose, followed by St Peter's, Lower Wycombe, Bromwich Roads and Lippard Grange. And it probably won't come as a surprise to many members. Worcester Town North is the lowest uptake rate, followed by Worcester Town South, King George, the Fifth Field and Maundon West. As I say, variations in uptake linked to a variety of factors. This is not just the Worcester challenge, this is an up and down the country challenge, particularly urban areas. And something that isn't just COVID related either. Talking to health colleagues, this is a similar picture seen with flu vaccination and other vaccinations that have been rolled out over the years. So it's not just a COVID related issue either. Percentage of residents vaccinated is also lower among the vast majority of ethnic minority groups compared with the white British population, and in Worcester uptake is consistently lowest for those identifying as Black African and Black Caribbean, although it should be noted that the overall numbers are far lower. And it's only more recently, as the vaccination programme was rolled into the younger age groups, as age as a light being shone on age as well. And the highest rates of vaccination can be seen in older people. So, for example, 96% of residents 65 years of age or over have had at least one vaccine, compared to 65% of those aged 18 to 24. So 30% difference. Like I say, update report on what we've done to try and combat some of that, and members will be aware of the three centres we've operated. The first of those in Brickfields. So as part of the IMT, we decided to focus the first vaccination centre on the electoral wards of Gorse Hill, Rainbow Hill and Maundon, which had some of the lowest rates in the city. King George V Community Hub was identified as a really good venue, not just because it was a community facility that residents recognised, but also, it had ample room. It was a good physical asset, and was sort of geographically well placed in between those three wards. It all came quite late in the day. We had 4 days to plan for it. So preparation took place between Friday 21st of May and Tuesday 25th of May. And we agreed to target a small number of postcodes to try and make it manageable, but really focused on those areas that needed the support most. And it was supported by a huge community engagement exercise that included the City Council, Worcester Regulatory Services, Platform Housing, and in particular Worcester Community Trust. So there was a big door knocking exercise wrapped around that to make people aware of the clinic, but also to encourage them to attend. It was a huge effort by all, but certainly in respect of our staff, 3.5 lists out some of the roles we needed to play. There were some eyes raised. We were stepping into new territory, but we were certainly up for it. So, we ran a call centre, a booking system for residents to be able to book, so we could keep pressure away from GP surgeries and the health service, which were already under great pressure. So our own customer services staff delivered that between 8:30 and 8 o'clock at night. Some of the more traditional stuff that we do, just making sure that we got the right equipment to the right building at the right time. Car park management was overseen by car parking service. That's what they do, they're good at. But interestingly, they also played a role in welfare. So when people had their vaccine and were going back to their car and were told just to rest for 15 minutes, we had our car parking staff just having a wander around, making sure everybody was fitting well. Variety of staff across the organisation played an admin role. So we had people from all sorts of roles, sat in the clinic, in vaccination booths, actually doing the admin to make sure people were logged onto the system and could be followed up. And like I say, community services certainly led on the door knocking campaign, and our comms team played a key role as well, not just in developing messages, but pushing messages out. 3 days of clinic, Chair, 537 residents vaccinated. And Appendix 2 provides a breakdown of that data. But I think it's fair to say that we believe we've met the two key objectives. So 88% of those residents were under the age of 40, and this is a clinic targeted at the younger age group with a Moderna vaccine. And even more pleasing, 90% of residents came from those 3 postcode areas. So it really targeted and got a return. So in terms of age and geography, we believe it was successful. And one of the clear messages that came out when we were talking to people who were turning up at Brickfields was that it was proximity, it was convenience, it was word of mouth that made people come along to be vaccinated. I can't underestimate the community engagement campaign. It was less than 3 days, and it was almost 3,500 doors knocked. Warwick and his team were Trojans, Worcester Community Trust, Platform Housing, our COVID advisors, Worcester Regulatory Services. It was astonishing, targeting 7 or 8 roads where we were able to see the uptake was lowest. And 51% of people sort of answered the door to us, so we were able to have a conversation with them. But where we weren't, we left literature that was in 3 languages, which ward members kindly supported us with, not just on the actual wording but also the languages to target as well. So a really huge effort. I mentioned the key learning points, Chair. Convenience, ease of access was the main draw. One of the things we probably tripped on, we didn't record ethnicity data when we were taking people in for a vaccine. So it's something that we've done since then, and we're looking to produce a report on that. And I think the other thing was that we left letters, we knocked doors, we spoke to people, but I think it's become quite apparent. The social media networks within social media networks. So communities have their own sort of channels and avenues. I think for us as a community team, it's for us to better understand that and try and find the community influencers who can sort of convey those messages for us or almost let us in. Following the success of Brickfields, we then turned our attention to another young person's clinic, which was held here at the Guildhall, 25th and 27th of June, and that was part of the government's walk-in weekend promotion. Big difference here was that it was drop-in, it wasn't booking. So we literally had people out in the high street and around the city centre, engaging young people and encouraging them to come into the Guildhall during those 2 days to have their vaccine. The clinic was extremely successful, 822 vaccines across the 2 days. And obviously the location just provided a higher level of footfall, so that helped. But I think the walk-in option as well just took a lot of barriers and hassle away from people. It was just far easier to do that than have to try and book into St Peter's or through a GP surgery or over in Malvern Showground. Following up on that, we did another on Saturday, the 3rd of July 21, again at the Guildhall, again drop-in targeting young people, and this time only 160 people vaccinated. We just wondered whether pop-ups have gone out of fashion. People had, had had enough of our messaging, but there were some other factors as well, which I've outlined in 3.15. There was a big football match that night, so we had a lot of young males saying they didn't want to risk feeling unwell, which is interesting in itself. The weather was also really poor on that day, and unfortunately, we also had an incident in the Guildhall, which led to an ambulance being outside for quite a bit of time. So I don't think that was going to attract anybody in either, but thankfully that all ended well. So across the three, Chair, we vaccinated over 1,500 people, and we're not saying some of those wouldn't have ended up getting the vaccine elsewhere. But I think what we've done, we've made it easier. We've probably picked up some people who wouldn't have, and I think we've certainly made it quicker for some people to access as well. So I think we've played a real role. Not getting carried away, and I think one of the managing expectations 3.17. I think there's a real sense that some people don't want to be vaccinated, whether that be personal beliefs, cultural backgrounds. So I think we've got to respect that. We've got to try and overcome that, but we've also got to respect it at the same time. But it goes back to that piece then about trying to understand that better. Who are the community champions, the community influencers, and is there more we can do? So we'll continue to support health colleagues to deliver more. We're actively having conversations and are quite close to arranging and confirming further pop-up clinics, and members will be made aware of that probably in the next 24, 48 hours, as I've outlined in 3.19. And again, Chair, just to finish off really and say, not just the effort of our own officers, but, Worcester Community Trust, platform housing, Worcester regulatory services, without them, this wouldn't have been the success it was. So that's probably enough for me, Chair.
Thanks. Yeah, I think it's really important to note just how spectacular this achievement is. So huge congratulations to everybody that was involved in it. I just wanted to pick up on a couple of things. There's a lot of reference in this report to being targeted at young people needing to get their vaccinations, and how, older people have all had their vaccinations, but younger people are needing to get them. I think it's really important to remember that when this first clinic took place in May, it was only just at that point that people in my age group were even allowed to get a vaccination. We are only just being allowed to get our first and our second jabs. So there's obviously going to be a big discrepancy between the number of sort of under 35s that have been vaccinated compared to those who are 50 and older. I was somewhat lucky. I had a group 6 priority, so I was vaccinated back in February, but I know other people of my age are only just being allowed to book their first at the moment. The other thing that I wanted to pick up on is, are there any plans in place to do a vaccination or a public health awareness campaign specifically targeted at pregnant women receiving their vaccine? Because as some of you may be aware, there is a really serious concerns at the moment that pregnant women are not getting the vaccine. There is a lot of mixed messages coming from people. Understandably, as somebody who's recently had a baby, you are a bit more aware of what you're putting in your body when you're pregnant. But there is a dramatically rising number of pregnant women getting COVID, because they are a really vulnerable group, and they're the only vulnerable group that in this entire pandemic have not been identified as a vulnerable group at any point. And they're not getting vaccinated, and we are seeing stillbirths, we're seeing preterm labours, and we're seeing women being admitted to hospital when pregnant with COVID. So are we doing anything about that? Are we going to be having any sort of campaign targeting that group?
So I think, Chair, I'd answer that by saying something of that type would be something that would be led on either nationally, through Public Health England, or more locally through Worcester County Council Public Health. But I can certainly pick that up and talk to the Director of Public Health about that, to see if there are any plans. If we could have a sort of a report back either to the committee or to myself, and then I would very much appreciate that, because it's a worryingly high number of pregnant women who are not being vaccinated. Karen, I think you had your hand up.
Yeah, I was wondering, are people able to come in for the vaccinations if they're not registered with an NHS number? I have been asked that question. And if they're not registered with a GP?
Yeah, thanks, Councillor. The first clinic we were quite strict, you know, and we were asking for that type of information. As the first clinic wore on, it became a bit more relaxed. It was about actually generally getting everybody vaccinated. And for the second and third clinics, you know, we didn't publicise that, but we were certainly pragmatic on the day, and actually it was about getting vaccinated. It wasn't about putting barriers in the way. So if somebody was to turn up and they didn't have that information, the important thing is we vaccinate.
Thank you, Chair. Thank you, Lloyd, for the report. St John's Medical Centre, where I had my first vaccination, looks like it's been taken off the second vaccination centre list. And we've had contacts from residents in St John's who have been directed to St Peter's without car, which means a number of bus journeys for them, elderly residents and vulnerable. So I'm wondering what we can do to address that kind of situation.
Thank you, Councillor North. Well, I wasn't aware of that, but again, I can certainly pick that up and find out the reason for that. But I think that's the sort of intelligence and information that allows us to think about, if we are going to do a pop-up, where do we do it? And even though, you know, a lot of this conversation has been around brickfields, I'm very conscious that, you know, this does tend to lend itself to certain areas of geography than others, but we need to keep a very broad look at this. It's not just, you know, it's not just one or two wards.
Thank you, Lloyd.
Steve?
Yeah, thank you, Chair. Appreciate we've noted the, as you worded it, spectacular efforts of all those involved, not just Worcester City Council, but other groups as well. And I think if through Lloyd we could pass on that appreciation to those groups, that would be a reasonable gesture, because they did do a sterling job. Just going on to paragraph 317 on the report, talks about how the wider communities and the key pieces of work for us as a council to better understand beliefs, identifying the problems in getting certain groups to take up the vaccine. And I'm just wondering, has that work been planned as yet, and what form it will take? Or is that something yet to be considered because we are so new in what we're doing?
Yeah, I think there is some work that's ongoing, but this is probably going to sound a bit twee. But for me, and one of the things that I drive, it's about conversations. You know, and it's about trying to have the right conversations in the right places at the right time. And we've recently had some money from Public Health that enables us now to drop what we call 3 community builders. So these are people that, you know, very rustically go about and have conversations in communities. They sort of learn, you know, what's going on in that community, you know, who are the movers and shakers. So that probably sounds a little bit vague, Councillor, but that's where I think, you know, we need to immerse ourselves in communities more, and try and learn more. So that would be the general approach, as well as, you know, trying to build and develop the relationships that we've already got with some organisations, but that can be made better.
Karen?
Just about to say, I think that sort of effort would be good for every aspect of what we're trying to find out. I think it's just going to be so invaluable. That's just amazing. Thank you. Lynn?
Yeah, I mean, this was a really good project. Doesn't sound quite the right word, and yeah, absolutely well done to everybody that made it happen at short notice. And certainly, I was at a meeting where the Director of Public Health reported back, and she did attend one of the days, and she was impressed by, you know, what we had delivered, what had been delivered at KG5, you know, and examples of people that accessed vaccination otherwise wouldn't have. So a couple of young men, Portuguese young men, and because it was later opening hours, that clinic, they were able to come along after work, whereas the main vaccination clinic, you know, they couldn't access it in time while still being at work. And an elderly gentleman, you know, where his door was knocked and he was given the information. and it kind of comes back, you know, to the communication network. You know, we might think it's been wall-to-wall news about this, but not everybody, you know, watches the TV, not everybody accesses those things. And, you know, he genuinely wasn't aware of the vaccination opportunities. I've certainly spent, you know, a number of years in meetings challenging bits of the NHS about trying to reach hard to reach communities, and you know, this is an example of having achieved that. I still think there is some significant kind of inflexibility, because you know, I know that, for example, the main mosque, you know, had offered to run vaccination clinic, but that has been declined by a part of the NHS somewhere because there's not enough car parking. Well, you know, if you're trying to reach people who can't drive, then maybe lots and lots of car parking is the wrong criteria to be looking for. And feeding back about this into a network of people, the sort of Worcester Inclusion Network, so a group, you know, supporting diversity and different kind of cultural aims. Again, one of the key kind of communication, not problems, people utilise different communication routes, and you're talking about, you know, community influencers. For some individuals, you know, their network of information is with, you know, the people back home, you know, and other parts of Europe have less of a culture of vaccination than we do in Britain. And, you know, those are the messages that are influencing them and affecting them rather than what, you know, the British government is putting out. But, you know, a really, really good piece of work that's really made a difference in the city, and yeah, well done to everyone.
Karen? Oh, I think Lynn knows them very well anyway, but would like you be able to help with that sort of thing?
I think they had some input, yeah, but they're pretty well networked.
Right, can we agree that we are noting this? Yeah. Right, oh, Robin, yeah. Did you want to? Oh. You agreed very exuberantly then. So we're going to move on to any other business now, and I believe Mike Johnson has got some other business for us.
What I did a brief report, which I was hopeful of going out on members' briefing, but apparently that isn't the case. What I've tried to do here, I think it's my third year on corporate parenting board at county, is to just give members an overview of the sorts of numbers of looked after children we've got who are nominally city residents, with the notion of trying to encourage, and it's a conversation I had this time last year, but didn't have much success. If you actually look at the numbers, if you do a rough calculation, we've probably got 7 or 8 kids, young adults, coming out of care into the city in any one year. That's not a big number, but it would be really good, I think, if the city actually did provide some focus around apprenticeships, around education and training. So I was hopeful that those committees who deal with those issues will actually start to think about, should we give some preferential treatment to kids coming out of care, certainly in terms of employment and certainly in terms of housing. Would be a relatively small number, but I think it would have a big impact on their life.
Thanks. Yes, Steve.
At last Monday's PED committee, we actually discussed the employment and skills strategy. When it was first written, I was instrumental in inclusion of looked after children in the first strategy. There is a review and a revised strategy, which is 2022 to 2025, which is will also incorporate all aligned to our corporate plan and government funding around Towns Fund and the High Street Fund. And this coming year is a transitional year, and money is available to the young and vulnerable residents, supporting with some employment skills. And there's also 16 to 20-year-old residents supporting to apprenticeships, and also the DWP in the autumn is going to launch a youth hub in the Hive, which will bring all the right agencies together. And what I thought was, it presented on with Amanda Lloyd and Nick Clay, and perhaps as part of the evaluation and the consultation, perhaps a short piece could come to this committee.
Yeah, I think that would be a great idea. Yeah, absolutely.
Yes.
Yeah. Mike, in your role at county then, can you, just for my own benefit, I'm looking at these figures that you've got on here, and there's quite a high number of children. The majority of children that seem to be looked after in the city are aged 10 and under. Do you know if any specific provision is made for them within the city with regards to things such as education, access to things like sporting activities and those kind of things?
I have to admit, I'm not aware of any specific services, but I would hope that there are. Perhaps Lloyd?
I think, Chair, certainly through the COVID period, there's been lots of funding to support young people, particularly of that age, to undertake physical activity, to help with food and nutrition, certainly during periods of non-term periods. I know obviously of the work that the Council fund. So I've not got the information at my fingertip, Chair, but but again, somebody like Warwick, would be able to update members on that, and we can come back to members and give a feel for that if you wish. But yeah, of course. Yes.
Jabba, you, and then
Thank you, Chair. I think that's an excellent idea in terms of where you're coming from. I mean, my partner is a senior consultant social worker, and one of the biggest complaints she always has is that they get so much care and attention up to a certain point, and then they're just released into the real world without that whole thing on. So it absolutely makes sense that if we have an opportunity to intervene, we intervene at that stage. And the only thing I would say is obviously in terms of our identification and in terms of talking it through with the individuals obviously involved, in terms of how we identify them and how they engage with that process. Obviously in a public profile such as the Hive, for example, they may not feel comfortable in that thing, but obviously focusing around their attention and their needs and keep maintaining that confidentiality. So I think that is the right step to do at the right time, to intervene so we can get them amalgamated into mainstream society.
Lynn?
Yes, thank you. Thank you very much to Mike for bringing this report to today. Following the local elections now as a county councillor, I've just joined the corporate parenting board, so I attended my first one. And the county council gave us the link to LGA training. So, you know, I attended a training session on corporate parenting, and I've got a better idea of what it's about. And it is, you know, sort of in loco parentis, you know, it is behaving, you know, like you would, you know, for a niece, a nephew, or a grandchild, you know, as to ensuring that they get, you know, reasonable access in life and that they get support. So, you know, it is really interesting to see what the figures are for the city. I mean, and a number of things were talked about within the LGA training. So a number of councils, a number of local authorities have a specific local offer for looked after children, you know, which may be about, you know, sort of privileged access to leisure services, for care leavers, about council tax exemption. So when they're then sort of, you know, trying to set up independently, whether that's a possibility. So you know, if I could perhaps formally on behalf of this committee actually ask if officers could look at what is our current sort of documented offer for looked after children, and then we can use that, you know, as a basis to say, well, you know, is this good enough? You know, are we happy with that, or are there areas that we would, you know, like to do more? And in light of the numbers, actually have a feel for what it might cost us to, you know, make free swimming available, or whatever it is, if members are in agreement with that.
Yeah, Chair, I'd probably just sort of guard against us, you know, perhaps straying into, you know, the county council's territory around looked after children, but we can certainly go away and look at that. But it's just not to blur the lines. That's
yeah. I mean, it's my understanding that it is, because it's been said in our council meetings in the past that we also as district councillors have a corporate parenting responsibility, and the fact that, you know, Councillor Johnson is the Worcester City Council representative on the Worcestershire Corporate Parenting Board, and each district council does. So, you know, although I'm speaking, because I'm on it as a county councillor, it is very much a district shared responsibility. And you know, it's not about interfering in children's services. It's what can we, within district council services, what, you know, how we can make life a bit better for children who had a really, really tough time.
Yeah. I mean, two specifics. What do we do for looked after children coming back into the city in terms of housing? And the other is, I'm old enough to remember work experience. Do we offer those individuals some experience of what work is like? Because they're coming from a very different environment. They've been, you know, in a care home or in an institution. So it's a real big change for them. I mean, some of them go off to university, which is great, and go into further education. But I'm sure there are numbers of looked after children who fall through the gaps. And that's one of the things we could try and plug.
Lucy? And the DWP are very, very targeted, and they really are. They almost, though it's at the Hive, it's only at the Hive because it's somewhere. It really is targeted for the most vulnerable people. So, and they will also go out as well, so that they pick them up. Okay. Richard?
First of all, apologies, I'm struggling to read the paper in front of me. The font is a bit small for me. Yeah, which is, yeah, I apologise. I may be asking a question which may be available to me in front of me, which I can't actually see. But my question is a form of looked after children, which isn't often addressed, which is the area of kinship carers, which we still have an area of huge area of responsibility. And I've spoken to a number over the years, either older siblings who are hardly adults themselves, or at the other extreme, grandparents or even great-grandparents who suddenly have children pushed upon to them without any experience, knowledge or warning, and are suddenly having to provide things like school uniform, toys, bedding, clothing for the first time. But the area of greatest pressure is in housing, where, for example, I had an experience brought to my attention some time ago of a resident in sheltered housing being asked to look after a child because of kinship care. And of course, sheltered housing does not allow children to live within sheltered housing. So the family had to be rehoused from sheltered housing into other kind of housing. But we have to be aware of these kind of issues and pressures. I'm not sure we always are, and we're not sure we always respond in the correct way. Because the initial response which I got when that incident happened was this person has made themselves intentionally homeless by allowing their grandchildren to come and stay with them. Well, clearly they had no choice because there was nowhere else for those children to go. And they are reinforced. I must admit this is some time ago, but I'm sure the responses could probably be similar today. So I do wonder whether we can have a look at how we respond to kinship carers and how we can give support and assistance to them, especially when it's immediately just happened. And provisions such as toys and leisure facilities may be something which we might be able to assist with, or that might be the responsibility of another committee.
Yeah, I'm sorry if I didn't quite catch it, but the very first image you've got on the far right, you've got this out of county / restricted. What is that?
County residents, but are not in a placement within the county. So particular looked after children with special needs might be up in Liverpool or who knows where, or kinship.
So they might be with another parent or something, or they might not be allowed to be kept. They have to be kept away from other parents, or their specialist mean they need to be somewhere else. That's quite a large number actually, isn't it? So yeah, but I'm quite pleased to hear that this city council has taken the responsibility and offering this parental care and guidance. I mean, you know, even if you're not a parent yourself, I'm pretty sure everybody here wasn't kicked out of their support network of a family at 16, and that is what's happening to a lot of people. And we only need to, we've heard it in the press this week, how other councils have badly neglected. Time and time again, we hear how in the past, perhaps, but badly neglected young people. And it's good to hear this sort of conversation going on.
Mike, that out of county and restricted, is that generally when there is no foster care available, no kinship care available, and no children's homes available? Is that when they then have to go out of county?
Or these are children with special peculiar needs that can't necessarily be accommodated within the county. Yeah.
That is a worryingly high number.
I mean, my understanding of the corporate parenting board that we act was a very, very lengthy presentation, wasn't there, about commissioning placements. And one of the things I thought I heard is that sometimes, although children are the responsibility of Worcestershire County Council, some are placed with foster carers or whatever within Birmingham because that's perceived as a better cultural fit. And there are, you know, some refugee, unaccompanied refugee children within these numbers. But again, you know, one of the possibilities that as a Worcester City community is maybe to ensure that some children have access to, you know, appropriate cultural celebration, you know, that they're able to celebrate Eid even if they're, you know, placed with a foster family who aren't Muslim, and, you know, to encourage a wider diversity of families to look at fostering, and because it's a really, really important relationship.
Yeah, just final thoughts, Chair. I mean, what we've managed to achieve in the city over this COVID period is testament to the fact that we are a kind and caring city, and that how we've responded to obviously looking after our homeless, looking after the most vulnerable in our society. And I think this is credit to this committee that we can bring stuff like this to this committee to show that actually we can respond to the real needs, the real difficult things that people don't really want to deal with, and for us to task that and for us to take that challenge on. I think it says a huge amount to the quality of council that we have, and that the fact that we can have such committees and talk openly and to tackle them.
I think that kind of brings us to a close this evening. So thank you, everybody. And special thanks to Mike for bringing this to us, being put on the spot.